Hello and welcome. Thank you for tuning in. I'm Pooja Shali. Everyone's been talking about the Omicron, which is some being dubbed as the variant of concern. I'll have all the questions answered today. At least we'll hope to. First, remember, what is the current status of the Omicron in India? 21 confirmed cases of the Omicron variant in the country. States are already gearing up to fight the super mutant threat with testing and contact tracing. That's also been heightened. Now, medical experts are suggesting that India is ready for now to tackle the super mutant surge if the need so arises. Take a look at this detailed report.
All states in India are on high alert due to the threat posed by the Omicron variant. The number of Omicron cases in the country has crossed 20. Rajasthan has the highest cases at 9. The State Health Department is isolating people who came in contact with the infected patients. In Maharashtra, where 8 cases are confirmed, tracing and testing has been intensified.
उनकी जो तबीयत है वो बहुत नॉर्मल है, कोई प्रॉब्लम नहीं है और उनको माइल्ड सिम्टम्स थे. उनके कॉन्टैक्ट्स में जो भी लोग आए थे, जैसा कि हाई रिस्क कॉन्टैक्ट जो क्लोज लोग होते हैं घर के और लो रिस्क कॉन्टैक्ट जो थोड़ी समय के लिए वह व्यक्ति कॉन्टैक्ट्स में आया होगा, उन सभी की जांच की गई है और वे सभी निगेटिव हैं.
17 people in the national capital have tested COVID positive with 1 confirmed Omicron case.
17 लोगों में से 12 की जीनोम सीक्वेंसिंग हो चुकी है. एक जो है ओमिक्रॉन पाया गया है.
The Delhi airport is aggressively testing passengers landing in the city. Union Health Minister Mansukh Mandavia reviewed preparations at the facility on Sunday night. Other states that are yet to report Omicron cases are also on high alert.
तो हर जगह जांच तो हो रही है. जब कहीं भी निकल गया तो इसका मतलब है कि फिर से तीसरे फेज का खतरा तो है ही. इसलिए हम लोग पूरे तौर पर अलर्ट हैं और हम लोगों की तरफ से तो जारी कर दिया गया और हमारे मंत्री जी ने भी इसके बारे में सब कुछ बता दिया है.
We are doing RT-PCR tests for all those who are coming from high-risk countries, and if they turn positive, what we do is that, as you know, we'll send the samples for genomic surveillance. We are doing that. That process is going on. There's nothing to worry.
Medical experts are confident India is ready to tackle a surge if it happens.
This is a time which the scientific evidence available. We understand the Omicron is highly transmissible. It is nearly 5 to 10 times more potent in transmissibility of the Delta virus. So we need to take all precautions to stop the transmission. Thereby, Indian Medical Association, we request the government to take adequate steps to ensure the appropriate COVID protocol is followed.
With the new COVID variant on the prowl, India is stepping up its guard to prevent a possible third wave. Bureau Report, India Today.
So let's have all your questions answered now, because I'm joined by Dr. Naresh Trehan. He's the chairperson and managing director of the Medanta Hospital, and he has been consistently updating us with all the information that's still pouring in about the Omicron variant. Thank you so much, Dr. Trehan, for your time. Now, the first question, and I know everyone's been talking about is, and we'll take one by one some of the questions so that we can have the concerns addressed. And the number one question would be, do existing vaccines that we have taken already, will they work against Omicron or not? For example, I'm double vaccinated. I want to know that I may have antibodies already. I have contracted COVID-19 twice in my case. But will none of this stand up, sir, to keep me safe against Omicron?
So, this is not very clear. That is what immunity does to you. What the antibodies do to you is to say that the virus can come inside your body, but you have the ability to fight it, to limit the extent of the infection. That's the immunity you acquire if you have had COVID once or twice or had your 2 shots. So the fact is that despite the fact that you have been double vaccinated, there is a smaller chance, but there is a chance that one can get infected. If that happens, it's milder, of course. And if it happens without the antibodies, like people who have not been vaccinated, then it is much more severe because the virus can freely multiply inside your body. If you have immunity, the immunity or the antibodies will actually limit the virus from multiplying, and eventually you'll get better. So that's the difference.
So if I can then ask you an added question here, what about the booster jab that everyone's been talking about after the 2 vaccines that we have taken, and other countries are already looking at the booster jab? Do we, you think, may need a 3rd vaccine shot, given that Omicron is now a mutated variant that is coming?
Most definitely, we should be looking at it. The fact is that if you notice, and there are many studies to show, that at about 6 months, the immunity from, as measured by us in antibodies, starts diminishing in most cases. So if that be so, and we are actually, from our current knowledge, thinking that the immunity comes from antibodies and it's a measurable thing, then you want to give the booster dose to increase the antibodies again, to prolong the immunity. That's the logic behind it. Other countries have started, because this is not only in COVID, this is in other vaccines also. There are other vaccines also, we repeat them, like for the flu vaccine, we give a vaccine every year because the immunity actually diminishes and also the virus changes. So you're doing both things. So that's why the logic is that today, if you have enough vaccine in your country, then that you can afford to give booster dose without depriving the ones who have not had their doses, then it's a good idea to start the program in a measured way. And the measured way, I would suggest one is that today the healthcare frontline workers, they were vaccinated in February last year, this year, at the beginning of the year. So 10 months now they have had from that last dose. And if you measure the antibodies in most of them, they have come down quite a bit. So this is the army which you have to prepare to fight the new wave if it ever comes. And that is why I think when booster doses start, the healthcare workers and the frontline workers should be the first to be vaccinated or revaccinated.
Well, absolutely. So does that mean, because we were constantly being told that wear your mask, continue to follow social distancing, that was for Delta variant, then are you saying that against Omicron, these are our precautionary measures again, that these will help us? Because there's just so much concern about this variant, but you are saying that same precautions will be our rescue this time as well.
No question. See, what happened is that this is what we call the lull period. Between the first wave and the second wave, there was a lull period of about 30 weeks. People got misled. People thought that the virus had gone away or we had won the war. Some declarations were made that we won the war. That is not true. It was proven so badly by the second wave that it went up 4 times that of the first wave. So, one should be very conscious of the fact that we are in that lull period right now. Third wave will come at some point. How high it will go, we don't know. So that's why we got to be very worried about the fact that in that third wave, if it was going to be Delta or something as benign, we'd be okay. But this Omicron, which has an R0 factor, R0 factor means the number of people one person who gets infected will infect, is 12 to 18, which is 3 times that of the Delta variant, which was responsible for the second wave. Now, if that's the magnitude of infection that spreads, we will have to have a very robust system to be able to handle all these people. It is expected that because our majority of our population is already vaccinated, that if it comes, that most people will have a mild infection. They will have mild symptoms and may not be requiring hospitalization. But you don't know if it overwhelms the country, what percentage of people may need hospitalization and oxygen and stuff like that. So I think we should be prepared. We should be very, very cautious. There's no need to panic, but we must take it very seriously. And the seriously means that we must be prepared in every way. How? So the people, like I said, the army that's going to fight the third wave, the healthcare workers and the workers have to be protected. The hospitals have to be ready. The bed capacities should be identified and ready to be converted whenever necessary. Oxygen supplies, whenever they are required, will be ramped up. So all these, and medicines that we will require. So all these things we should be ready. Although there are some things. The favorable things today are, one, that like I said, people have been vaccinated. Two, there are oral pills now coming out, which will hopefully get approved soon by Pfizer and Merck and all that, where you can actually take these pills if you get infected and you can limit the length of the infection right away, which is now being done with monoclonal antibodies. Now, monoclonal antibodies are given by injection, but they also cost a lot. So if the new drugs come and we have antivirals available, we may be able to limit the total extent of the infection a person can get.
Definitely, I think these are some of the lessons that India needs to take with regard to how globally cases are increasing. So again, because this is a question that I've repeatedly got from our viewers, is that if that is what you can elaborate on, is that mask wearing and social distancing, do you think, will have to be followed very strictly this time if we do not want that third wave to arrive yet again in India, Dr. Trehan?
So let's separate it. First of all, there is no question we need to go back to masking and following the 3 tenets of COVID appropriate behavior of distancing and hand hygiene. This we have to do. In addition, we should all be vaccinated, and people who had any hesitancy about that, their fear should go away, because over 125 crore people have been vaccinated and there is no major side effect that has been reported. So you should feel comfortable that the vaccine is safe. So everybody who's not got it must get it. People must mask, not go into crowded places. If you have to, double mask. Always stay at a distance whenever you can help it. And also hand hygiene is always a good accompaniment to it. So these things you must follow right away for your own protection, for your family's protection, and also largely for the country's protection. Because if you let the guard down and this virus, which is supposed to spread like wildfire, does happen, that will be a major burden on India, not only human-wise, but also economy-wise. So we can't afford it. We are still recovering from the second wave. So we should do everything in our power to actually stop this virus from spreading.
That's right. And so I have an added question to that, because this is what also have been sent for the past few days to us. This is a festive season. We saw the travel restrictions previous year as well. Do you think, if despite our precautions, despite our best efforts, the variant does become concern for India, are we looking at travel bans? Do you suggest a travel ban, perhaps? Because it is, again, these are international passengers and we eventually are going to be meeting each other. So do you think that is what we are looking at possibly?
I think all of those things have to be done in a calibrated manner. I think it's a good idea to restrict the flights from areas where it is identified that there are cases in large numbers. Those areas should be isolated. People who have arrived here from them must be tested and all their contacts traced and treated. Isolation has to be done for people who are coming from those areas. So all those measures that the government of India has already put in place are required. And I think that if need be, they can be calibrated up depending on what the numbers show.
Dr. Trehan, here I just wanted to ask you, because we tend to socialize with each other nevertheless, even with international passengers. So what do you think?
No, I'm just saying that that's about it. That there's not much to, it's all repetitive after that.
Yes.
That it's basically a personal war against the virus and the national war by the government putting in the regulations that are necessary. Do try to size your wedding parties, close the nightclubs. I am against, because nightclubs are a total trap. Even if one person in there has it, then the whole crowd will get it. So you can, and that's highly avoidable for the next 6 weeks.
And what about then the RT-PCR test? Does it detect the Omicron variant? Because we have to get the test done regularly for travel or work, or simply to confirm if our symptoms are of COVID-19. Do you think the S gene is being detected this time in the RT-PCR?
Well, it seems to be detecting every time, and then the point is that if you suspect it is from the new variant, then you'll have to do gene sequencing. The Omicron is not going to be detected straight by RT-PCR, but it will be if you do the gene sequencing, which is done by specialized labs, and wherever suspected, the samples must go. So then that's when we know the real extent of it.
And just to wrap up, a final question here, Dr. Trehan. I have children at home who are clearly still not vaccinated. So if the Omicron variant affects younger population, like the South Africa health system has also mentioned, do you think parents' concerns are justified with the faster transmissible virus that is around us now? What happens to our children at home?
Not only justified, I think they should be obsessive about it to protect the children. It's a matter of next 4 to 6 weeks where we will find out what the extent of this problem is and how much infection is spreading. So according to that, there are two things. We are hoping that vaccine for children will come around in the next few weeks, hopefully. That will give us a relief. The second thing is the children should be masked whenever they go out, because if they protect themselves, that's the best way of doing it. So treating them, I mean, there is some reports from South Africa which says under the age of 6, those children are getting serious infections. So I think there's no time for complacency. We have not understood Omicron yet completely. Data is coming in real time on a daily basis. Pretty soon the data will be transferable into some knowledge, because right now it is not, the sample size is not large enough to make full deductions out of it. But I am hoping in the next week or 10 days we'll know more about the virus and we'll be able to give better guidelines to people.
Thank you so much, Dr. Naresh Trehan, as always, for your time and expertise. And there are some very valid concerns that you've been able to help us with the answers today. Thank you so much, Dr. Trehan, for the latest. Now, remember, Dr. Trehan has also just now mentioned about the younger population, the children as well, and how we all have to ensure that they are kept safe. Because this Omicron variant has crippled South Africa already. The nation has reported 16,000 cases of the 5th variant of COVID-19. There are now concerns about children below the age of 5 years who could be infected by the Omicron variant. Watch this report about why the children focus is back again with Omicron.
The mutant Omicron has raised fresh concerns in South Africa, as the country recorded 1,655 infections and 25 deaths on Friday. The South African Health Ministry says it is witnessing a sharp increase in new cases, particularly in children under 5 years.
Probability that clinicians are admitting patients as a precaution while there are beds available, and so more, young children are being admitted, whereas, later in the wave they wouldn't meet the criteria for admission.
South African health authorities say while the incidence is still low in children, however, it is now second highest in those under 5, next only to the incidence rate in those above 60. Gauteng province, which is the worst hit with up to 80% of daily infections, health officials are on high alert. Hospital admissions have been dominated by those who are not vaccinated and young people below 40. Back in India, the urgency of children's vaccination is still under a cloud, as experts continue to raise questions.
That's very worrisome, that we don't have anything for children yet. And we should try everything in our power to actually get it ASAP so that kids can be protected, because it's going to be also devastating if children get infected.
If you want to save our pediatric age group, other than COVID appropriate behavior, get yourself vaccinated. You should have 100% adult coverage, and we should approve pediatric vaccine as soon as possible, vaccinate them.
But centre is dragging its feet over the issue. Zydus Cadila Zycov-D vaccine was meant to be the arsenal against COVID for children. Even Bharat Biotech's Covaxine for children is awaiting approval from drug regulatory authorities.
Well, the Indian government is on the view that children's vaccination is not a priority at the moment, and the second dose coverage remains most important in the country. The data shows that even during the Delta variant spread in the country during the second wave, children remained asymptomatic. There were some cases of MIS-C with complications, but that number was very low. But in the light of the recent Omicron mutant that has entered the country, concerns persist on children's vaccination and how soon can India work towards it to stay a step ahead of Omicron. With Ashwini Helen in New Delhi, this is Milan Sharma for India Today.
So that's all the time I have today, and I hope some of your queries, concerns and questions were answered. But just take care of yourself, stay safe, stay vaccinated and follow all precautions as the experts have said.